Hello, this is Marcos Patchett, the Nocturnal Herbalist, and this is my second video on cannabis or medical marijuana. And in this video, I'm going to be talking about the indications for cannabis use in cancer, but particularly the symptomatic indications, what symptoms it can be used to benefit, and also its contraindications, when you shouldn't use medical marijuana at all, both general and specific to cancer as well. Just before we begin, there's one previous video, an introductory video, where I covered the general pharmacology of cannabis and its use in medicine, and also just mentioned the potential legal issues. Cannabis is still currently illegal in the UK, so I just want to preface this video by saying again that I do not endorse the use of any illegal substances. As a herbalist, certainly in my professional practice, as a private citizen, as an individual, my personal views as a libertarian are that all psychotropic substances should be legal and controlled and made available in a controlled and prescribed manner. But that's separate from the current legal ramifications of possessing and using cannabis. So if you are in a country where cannabis is illegal, please do not take this video as some sort of endorsement of its use. In other words, don't go out and do anything illegal that could get you into trouble and make a difficult situation worse. This video is for informational purposes only, okay? All right, so indications and contraindications. Oh, and yeah, I talked in the first video a bit about why I'm qualified to talk about this, so go and have a look at that if you want. Anyway, indications. Just generically, the symptoms for which cannabis is useful and might be particularly useful in cancer are pain, and in a few studies, over 70% of cancer patients living with pain reported improved pain control or reduced pain when using medical marijuana. And that was in an open study, which means there was no placebo group. So some of that effectiveness, because that is quite a high percentage of patients who experience relief, some of that might be placebo, but the point there is that 70% of patients did experience some relief with the marijuana. So if it was compared to a placebo, that number might be less, but in practice it was useful. There is, however, a study that's being done with a placebo that's not using the whole leaf cannabis, but a semi-synthetic preparation called Sativex, that's its trade name or whatever, which is a combination of THC and the cannabinoids, and the CBD rather, and that also effectively reduced pain in cancer when compared to placebo. In other words, it had an effect greater than placebo. So that's some testimony from clinical evidence, from the sort of gold standard clinical evidence side of things, which suggests that it is very helpful for pain. And I'll include all the studies in the sort of description box below. The second thing it's useful for is nausea. It's very useful for reducing nausea, which often occurs when people with cancer are receiving chemotherapy treatment. And its effect there still remains to be quantified. In other words, there are some drugs that are prescribed against nausea. One of the main ones is ondansetron, which is quite powerful. In one trial, cannabis performed less well than ondansetron, but that's one small trial. We need more trials, and certainly there is a lot of clinical and anecdotal evidence, both, to suggest that it is useful. And the third thing it's useful for is increasing appetite, which really goes hand in hand with the nausea thing. In cancer, there's often weight loss, and that can be weight loss directly as a result of the cancer itself. If cancer spreads, then it starts taking away nutrition that the healthy organs of the body need, and the person often starts losing weight. It's a symptom of cancer, particularly as it advances. But also that can happen with the treatment. If you're taking chemotherapy, for example, you feel so sick and often lose all your appetite. So cannabis has this dual facility of reducing nausea and increasing appetite, which is quite helpful. So those are the main things it's useful for in cancer. So not trivial. The fact that it combines those three facilities of reducing pain or improving pain control, improving appetite or augmenting appetite, and also reducing nausea makes it very appropriate to consider as an adjunct or an accessory drug in many cancer treatments. Okay. Contraindications, when you shouldn't use medical marijuana. And this is, of course, aside from the legal issues that I mentioned at the top of this video. This is just from a purely clinical, pharmacological, whatever level. Okay, so the main contraindications, just general contraindications, I would say the top two are pregnancy. If a woman's pregnant, because there's some evidence that cannabis might have adverse effects on the fetus. It might be slightly teratogenic, that means toxic to the growing fetus, which is not good. And I mean, it's not strongly that way, but it's not good. And the second major contraindication, general contraindication, would be schizophrenia. Or I would go with any form of sort of psychotic mental illness, even including bipolar. So that would be a personal history of schizophrenia or bipolar disease or anything involving some sort of psychosis. A personal history, it's absolutely out. You should not use it at all, because the evidence suggests that it does slightly increase the risk of developing such conditions slightly, although we need more studies and trials to confirm that. But there's a definite association with increasing the risk of developing it. Well, let's not say definite, but there's a very high probability that it increases the risk of a psychotic episode in someone already predisposed to them. But I would also go further than that and say anyone who has a family member, particularly a close family member, a brother, a sister, a parent, even a cousin, who has some sort of psychotic disorder, because the genetic tendencies, the genetic risk factors are often quite strong. So I think, for example, if you have a sibling who has psychosis, I might be wrong about this, I'll try and find the statistics and put it on the video, but I think if you have a sibling, a brother or sister who has schizophrenia, I think your risk is 25%. If you have a parent, your risk is 50% of developing a similar condition. And you don't want to be messing with any substance which increases that possibility. Because, you know, if you have a cancer diagnosis and also subsequently have a psychotic break, that might be called making a bad situation worse. As far as the pregnancy thing goes, I mean, when you're using marijuana as a medicine in cancer, one might argue that it really is situation dependent, right? So if the pregnancy is advanced at the time of diagnosis, which is obviously a very difficult situation, then one should probably avoid cannabis. But of course, a lot of the drugs that are used to treat cancer, a lot of the main chemotherapy drugs, which I'll be doing another video on soonish, may themselves damage the fetus. But just as a general rule, you should avoid it unless you are willing to risk some harm to the fetus. So that's a general contraindication. More general contraindications that probably don't have such a bearing on the use of medical marijuana in cancer. Obviously, well, actually this one would. Yeah, allergy to marijuana. If you're some people do have that. It's not common, but obviously if you're allergic to marijuana, don't use it. You can test that if say you're in the position where marijuana is illegal where you are, and you or someone you know has a cancer diagnosis but has never used it before. In order to do this is a very simple check to see whether you might be allergic to it. You can obtain a sample, say a bit of the leaf or a bit of the resin or whatever form you're using, and mix it with some carrier oil that you're not allergic to. So obviously if you're allergic to peanuts or something, don't use peanut oil, but so say olive oil will do, something like that, just because the cannabinoids are oil or fat soluble. So grind it up with a bit of that, and then apply a little bit of that just to your arm, and then put a sticking plaster over it and leave that in place, a waterproof plaster, and leave that in place for around 2 days or 48 hours. If when you remove the plaster there is significant irritation and reddening of the skin, and truly if there's an allergic response to cannabis it might take less than that, you might get significant itching or whatever sooner than that, then you might want to avoid marijuana. Marijuana allergy, as far as I know, isn't common, but it could be a thing. And then fertility, marijuana use actually slightly reduces fertility. So people who are trying for a baby, and this applies both to men and women, should consider not using marijuana. It does reduce fertility apparently in both men and women. And again, links and references below for those who are interested. And in pursuing what I'm saying and checking, verifying that what I'm telling you is true, which you should do if you're going to be taking this advice. You should always verify advice before you take it, ideally. And then the last thing would be obesity and diabetes. Now that's not an absolute contraindication, that's more of a caution. And the reason for that is that marijuana use slightly increases blood sugar levels, and it does increase lipogenesis in the liver. And what that means is it affects the metabolism to cause the liver to make more fats, more triglycerides, which if you are overweight, and particularly if you already have a metabolic disease like diabetes, may tend to slightly aggravate it. In cancer, in a cancer situation, that may be the least of your worries, and something that, I mean, it's a relatively minor effect. It's not it's not going to shoot your blood sugar up and make your liver become all fatty overnight. It's just going to a small, a low level effect. But it's certainly something, if you're thinking about using marijuana long term as a medicine and you already have either diabetes or fatty liver, like liver cirrhosis or non-alcoholic fatty liver disease, or are obese, then it's something that you might want to reduce. I mean, of course, the appetite increasing effects of cannabis are also not great if you are overweight. So those are some general contraindications or cautions against the use of medical marijuana. Specific to cancer, well, there are two. The first, and this may turn out to be overcautious, but I would suggest do not use medical marijuana at all if you have testicular cancer. And the reason for that is that there is an epidemiological study, referenced below, conducted by Callahan et al., meaning Callahan and his colleagues, from 2017, which showed that populations who smoked marijuana more had a higher incidence of testicular cancer. Now, of course, that's a population study, so there might be lots of other reasons for that, but the people conducting the study did control for other variables like smoking. It wasn't tobacco, it wasn't other things they were doing. It did appear to be specifically related to the marijuana intake. And of course, cannabis has not been linked to other cancers, to causing or increasing the risk of other cancers. But testicular cancer it has been, and that does fit with its observed influence on fertility. We know that it decreases fertility in both men and women, which might imply a negative effect on sort of ovaries or testes, the gonads, which might imply an increase in sort of DNA damaging effects on those specific organs. A string of mights and maybes based on an epidemiological or population or correlation based study. It's not hard clinical evidence, but given that information and the correlation with cannabis is known suppressive effects on fertility, I would strongly advise you to avoid using medical marijuana in testicular cancer specifically. That doesn't seem to be associated with ovarian cancer, but with testicular cancer it was. So then the second time I would say definitely avoid using medical marijuana in cancer would be if you are receiving an immunotherapy treatment. So I'll get into this in my video on chemotherapy a bit more, but broadly speaking, there are two types of chemotherapy treatment. In fact, there are lots of different regimens and whatever, but there's the old school chemotherapy, which is still in use, which attacks cancer cells and kills them directly. It's cytotoxic, it's cell killing, and it kills fast replicating cells. Cancer cells specifically, affects other cells too, but mainly cancer cells, of course. And then the second type of chemotherapy, this is a newer variant, is immunotherapy, where drugs are given to that may mimic an antibody or antigen, as a protein that stimulates an immune response, basically. Or sometimes they're antibodies. They are you're given these things that essentially are supposed to either directly attack the cancer cells or, more commonly, incite or encourage your immune system to sort of go into hyperdrive and attack the cancer. So those new drugs are immunotherapies. And cannabis, it's been found, actually reduced the effectiveness of immunotherapy. They tested it, this group led by, checking my notes, it was Taha et al., Taha and colleagues in 2019, again, study links below, found that when people taking medical marijuana, they did a comparison between groups of people who were receiving this immunotherapy called Nivolumab, and when the marijuana smokers had lower, had more failure of treatment. Much more failure of treatment. I think it was something like 30%, but I can't remember. It's been a while since I actually read it. I've just got my reference here, but it was a significantly worse outcome for people using medical marijuana while they were receiving immunotherapy. And there is a reason for that. Cannabis, as I think I referred to in my first video on the general pharmacological properties of medical marijuana, does slightly suppress specific immunity, and that makes it potentially useful in some autoimmune diseases, may reduce progression of multiple sclerosis, for example, requires more trials and information, but may possibly do that, but makes it not so good if your therapy relies on you stimulating the immune system. So it's logical that cannabis may not be the best thing to use if the drugs you are on are designed to increase the immune response, because cannabis actually decreases it, or at least appears to do so from the information we currently have. And that would certainly correspond with this trial suggesting that people using this Nivolumab, which is an immunotherapy, had poorer outcomes. So the two specific situations you definitely do not want to use medical marijuana in cancer are: one, if you are a man with testicular cancer, and two, if you are on an immunotherapy treatment. I would strongly advise you not to use medical marijuana in those cases. Plus, of course, the more general contraindications, the most, I would say, important of which are if you are, of course, allergic to marijuana, if you have a personal or close family member history of psychotic illness, or if you are pregnant. So I hope this video has been helpful. The next video will be on the potential anti-cancer activity of cannabis and cannabis extracts, and this is where we get really technical, and I'll kind of enjoy myself talking about different cell lines and stuff. So the next video is going to be about cannabis's potential direct cancer cell killing activity, and whether there's any truth to that, and in which cases it might be useful. But that'll be really about the science. I'll talk about dosages and when to use it, etc. So anyway, if you've watched all this, thank you very much. I hope it was useful, and hopefully see you in the next video. Oh, and if you like this stuff, then please subscribe and like it and do all that. All right, thanks a lot. Bye.